Okay, good morning. Thank you, everyone, for being here. I'd like to acknowledge the people at the podium with me. Of course, our County Executive, Laura Curran, Northwell Health President and CEO, Michael Dowling, Nassau University Medical Center Chairman, George Sunis, Lou Grossman, President and CEO of Maryhaven Center of Hope. We're here this morning to announce the expansion of a life-saving partnership that is moving us forward in our efforts to end the affliction of opioids in our community. We believe it's the first of its kind in New York State. In 2015, I stood here and said that I was committed to using $585,000 of money that we seized from criminals to expand the services and the admission hours of this wonderful facility, New Hope. That funding helped New Hope expand its operations with additional medical staff to operate 24 hours a day, 7 days a week, administering medically assisted treatment as needed to ease withdrawal symptoms. Now a person in crisis can be admitted around the clock, after an overdose to detox, withdraw, and navigate the path to long-term treatment. I'm proud to announce that since 2015, New Hope has treated over 2,000 people. Despite this success, we know we needed to do more, because when a person overdosed and was taken to a hospital, medical protocol required that the person is stabilized and then released back out into the community, sometimes in the worst throes of withdrawal. We realized that after their release from the hospital, those who overdosed would frequently go right back to their dealer to get more drugs to relieve the suffering, and sometimes tragically ended with their overdose and death. While withdrawal alone would not directly cause a person's death, it was clear to us that releasing a person onto the streets in that vulnerable condition, instead of shepherding them to long-term treatment, was the wrong approach, and we needed to address that. No brochure listing treatment providers would solve this problem. Families didn't know where to turn, and those in crisis are seldom equipped to navigate the insurance complexities, the voluminous paperwork, the delays for beds, and the simple logistics towards treatment. We needed to close the gap between a person in crisis at the emergency room and the life-saving treatment that they needed. In February of 2017, I spoke with Michael Dowling, CEO of Northwell Health, about integrating New Hope services with Northwell's hospital emergency departments. He recognized the challenges we faced and readily and immediately committed to helping. After 2 years of planning, navigating complex HIPAA and patient privacy laws, I'm thrilled to announce that we are finally here. Yesterday, Northwell and New Hope began a pilot project to integrate New Hope's counseling and transportation with Northwell LIJ's emergency departments. And when I approached George Sunis, the chairman of New Health, about joining this integration project, he also immediately agreed. And he did more. I'm proud to say that NUMC committed to a Vivitrol reentry program, which Mr. Sunis will talk about. Together, we're closing the treatment gap for thousands of vulnerable Long Islanders with the promise of more Northwell hospitals to follow. Those who overdose will now be seamlessly transitioned to the treatment they need, and we know that this program will save lives. Research shows us that immediacy in treatment can be the difference between success and relapse. This program was designed to engage the patient immediately after medical stabilization and to provide the patient with a physical space to go and start the treatment and healing process. New Hope provides a safe place to either detox or to continue medically assisted treatment while the patient's treatment needs are met, and a seamless transition can be made to the next treatment facility. New Hope is not the ultimate treatment provider. While the patient is at New Hope, counseling begins for the patient and the family while the staff navigates the private insurance, Medicare, or Medicaid paperwork needed to continue treatment. If a bed is not available at the next facility, the patient remains safely at New Hope until the transfer can be made. The average length of stay for a New Hope patient is between 7 and 10 days. As district attorney, I have met countless people affected by the heroin crisis, and I routinely speak to parents and caregivers and spouses who have lost a loved one in the throes of addiction. Heroin does not care who you are. It does not care about your socioeconomic background. It doesn't care about your zip code. It doesn't care how old you are or your gender or your age. It is impacting every corner of our county, and it is an equal opportunity killer. We must continue to speak openly about heroin and the importance of treatment for those who are suffering, because addiction is a disease. Addressing this treatment gap has been one of my first and major priorities, and we cannot become complacent. The threat continues, and it is deadly. In 2016, Nassau County lost 195 people to drug overdoses. In 2017, the number of lives decreased to 184, and as of today, the medical examiner's office has certified that 123 people were killed by opioid overdoses in 2018, but testing is incomplete, and that number is sure to rise. We can never lose sight of the fact that even if the numbers continue to decrease, we already know with certainty that losing 123 souls is one too many. We must never stop our efforts to get that number down to 0. I can't thank the professionals at NUMC, at New Hope, and at Northwell Health for facilitating this program. Mr. Dowling, Mr. Tsunis, and Mr. Grossman, thank you for your efforts, and with these efforts, I'm confident that we are saving lives. I will now turn this over to our great county executive, a great ally in this battle of ours against opioids, and a friend, County Executive Laura Curran.
Thank you very much. I first want to thank and applaud District Attorney Singas for this first-of-its-kind partnership between her office, New Hope, NUMC, and Northwell. I can't overstate that. This is the first arrangement of its kind like this, and she's a real trailblazer, and we're very happy that you're doing it right here in Nassau County. So thank you. So we know that drug overdoses kill more than car crashes, gun violence, and HIV/AIDS ever did. We are, as District Attorney Singas pointed out, making progress. The number of overdoses are decreasing, thanks to our police department, to our volunteer fire service, to our medics, to our EMTs, and also to the relentless work of the District Attorney and her team. They're putting dealers behind bars. But, as District Attorney Singas always says, we cannot enforce ourselves out of this crisis. So by zeroing in on the treatment gap, in that critical window between being revived from an overdose, surviving an overdose, and getting back into your community, by zeroing in on that, by partnering with Northwell, with NUMC, and with New Hope, getting more beds, more treatment, will save more lives. Thank you.
Okay, at this time, I'd like to call Michael Dowling to the stand. Thank you, Mr. Dowling. Stand, sorry. Bad habit, bad habit.
No, I'm glad it's this kind of an event we're doing. I just want to, again, as the county exec mentioned, express sincere thanks to the district attorney for her commitment here. We have met on issues like this a number of times. And I can tell you, for somebody in her position to take such a humanistic view about a social need that is absolutely extraordinary is something to be applauded. And I want to say a special thanks to you personally for everything that you've been doing, and obviously for the county exec for being here, which obviously sends a message. And of course, my friend George to my right will speak in a few minutes. We are delighted to have this relationship because to be able to deal with an issue like this, it's all about partnerships, and nobody can do this alone. The issue is huge. Closing gaps is a continuous process. What we do today makes a difference, will make a difference, but we got to continue making a difference because the gaps will still exist despite all of our best efforts, and we just got to continue building upon what we're doing here to continue to do more. Everybody is aware that addiction is an extraordinary issue that affects families, as has been mentioned. I doubt that there is anybody in this room that hasn't been affected either directly or indirectly, or has friends that has been affected by the issue of addiction, whether it be alcoholism or opiates or other forms of drugs. I can tell you that it has affected my family. I've had siblings in serious situation with regard to this, and still have them occurring as of today. And even though you are in the medical profession and you know a lot of people in the medical profession and you know people that are expert on this, and the need for treatment, they need to be able to get to people quickly, need to be able to communicate and be able to break down that barrier that often exists between people who have a problem and their willingness to actually go and get treatment and get service is not an easy thing. This is a combined effort that all of us have to take part in. Northwell, we have a whole variety of programs that we have ongoing on an ongoing basis to deal with the issue of addiction. We are one of the largest providers of mental health programs, for example, in the state of New York. I have a lot of the staff here that do the work on a day-to-day basis. And through our emergency departments, as the district attorney mentioned, we have an ESPERT program, which is screening program, basic screening program. ESPERT is the name that we give it, but it's a screening program, and we have already screened over 800,000 people through our emergency departments. And now we have to extend that into the ambulatory facilities, which we have 720 of. But it's one thing to do a screening, but then when you identify somebody and dire in need, or somebody that is likely to be in need, you need some place to have these people go. That's the bridge between where you are and what it is you need to develop in the long run. And this program here at New Hope is that bridge program that can save lives. It has saved lives. It does do it today, and it will continue to do it. And I want to give my compliments to the staff here at this facility for the work that they do on an ongoing basis. This is something that is a struggle that we will continue to have to work with. This is a huge step. And I would just want to thank all partners, including George and County Exec and the District Attorney, because the more we work together, the more we appreciate the need, understand the difficulty and the severity of it. But it is everybody's problem. It's not just one person's problem or one program problem or one provider's problem. It's everybody's problem. So together we can collectively make sure that we deal with it in a better way going forward. And we've made progress, but we're a long ways from the finish line. Today is a step closer. This is a positive thing, and I am delighted to be part of it. And you have the commitment from me that Northwell will be at the forefront, working with everybody else to do everything we possibly can, but on the screening side, the delivery side, dealing with medications, for example, that get rid of all medications, dealing with medication prescribing so that we reduce the prescribing. We have a dashboard that we use in all of our facilities for this. And also it has to do with education. We, for example, now in our medical school provide about 26 hours of education. A typical medical school provides, and a typical doctor gets about 2 hours of education on issues around addiction and substance abuse. That has to be dramatically expanded if we're going to make a difference, and we've already been doing that. Lots of issues, lots of programs, lots of efforts, all in the struggle against something that is unbelievably complicated and difficult. And I am delighted to be part of it. And I want to thank all the people here that are working on it. And I want to thank the media for being here and obviously communicating this to the general public, because this is a general public issue as well. And I just want to thank you, and let me turn it back to the District Attorney.
Thank you so much, Mr. Dowling. Now we'll hear from George Sunis.
Thank you, Madam District Attorney. I would be remiss if I didn't thank Michael Dowling and Northwell for the assistance, guidance, support, and resources they have given the Nassau University Medical Center. We are the only disproportionate share public safety net hospital in Nassau County. And when the book is written, it will be this week when Northwell stepped in to help us, meant the survival of NUMC and to see NUMC thrive. So, Michael, thank you very, very much. And on behalf of 1.3 million citizens of Nassau County and being the hospital chairman, thank you very, very much. We are here to address an epidemic. Opioid addiction has been around for many, many, many years. To be honest with you, it surprised everyone. Its blitzkrieg effect on our society is something that we were caught flat-footed for. New leadership came into Nassau County. The district attorney, you can see the importance she places on this issue. She brought all of us together. There isn't a week that I don't get a phone call from Madeline Singas saying we need to do more and here's what you need to do. And there are 3 initiatives at NUMC that I am going to announce. Every single one of them an idea from the district attorney because she is practical. She's attacking this at every level. The county executive has been all over this. She has a wonderful police force. She's made it a priority, and we're actually starting to see opioid-related deaths come down slightly. We're making progress. We still have a long way to go. Today, we're here at New Hope to announce a warm handoff. Too many times, children have been Narcaned back to life. We tell the parents to come pick them up, and they take them home. It has not worked. The county executive and the district attorney recognize it did not work, and we've created programs like this where people can get extended care so we can deal with this comprehensively so they do not relapse. I'd like to announce the programs that NUMC is undertaking. We have 22 new medically treated beds to treat individuals suffering with drug and opioid-related overdoses. The new chairman of our psych department, Dr. Ioannou, who's here today, said, George, we need to start treating the patients that really need our help. So we pivoted the resources at his recommendation immediately. It was the right thing to do. Secondly, on weekends, and the district attorney suggested this, we've expanded our options for long-term recovery by offering Suboxone, a drug used in treating those who are fighting their addiction, blocking the receptors in an addict's brain, and ultimately reducing the urges to use again. I'd also like to talk about the third initiative, and this is the first ever Memorandum of Understanding in the state of New York. In cooperation with the Nassau County Correction Facility, NUMC will make Vivitrol, a similar drug that reduces opioid dependence after detox, available to those individuals that may need it days before they leave the Nassau County Correction Facility, at no cost to NUMC, at no cost to the taxpayer. Now, why is that significant? As the district attorney has educated me, inmates are 12 times more likely to die of a fatal overdose in the first 2 weeks of being reduced. Again, practical solutions, bringing people together. These are all major stakeholders to comprehensively address a problem that has existed far too long. I look forward to the day where we can have a press conference announcing that we have eradicated this crisis. But in the meantime, NUMC and all our other partners here will do everything that is necessary to address it completely. Thank you.
Okay, thank you, Mr. Tunis. Our final witness, Mr. Grossman, thank you.
Thank you. I guess there's always a advantage or disadvantage of going last. So I'm here on behalf of Maryhaven Center of Hope, which is a member of Catholic Health Services. And together with the system, we joined together to combat the drug epidemic, which continues to destroy families. Too many lives are lost. I acknowledge the continued support of the District Attorney, Madeline Singas, and I'm confident that our partnership with Northwell and Nassau University Medical Center will save lives. This incredible facility, appropriately named New Hope, offers the only 24/7 residential stabilization program on Long Island, probably throughout the state. We admit a patient recovering from an overdose directly from the hospital's emergency room. This will close a major treatment gap of our program. We have 30 beds, and we provide medically assisted treatment, psychiatric counseling, and we help to secure a placement in long-term treatment program within 14 days. It all sounds wonderful. There's problems. We don't have enough psychiatric support available. Why did it take 3 years to get to this point? It's an inability to have the resources necessary to obtain the necessary psychiatrists, nurse practitioners. That's where the next step goes. We do, at this point in time, have psychiatrists on staff, psychiatric nurse practitioners, so Maryhaven, New Hope can continue to work in the stabilization program and provide the medical assistance. But the tomorrow really rests on having clinical supports across Long Island. I thank everyone for your support. It will make a difference. Thank you.
Okay, thank you. We'll take some questions.
Can you explain exactly how it would work from somebody recovering who may have been revived with Narcan in the hospital? What exactly happens step by step?
So, I mean, I can't tell you exactly step by step because I'm not a medical doctor, but if someone is brought into the ER, they are stabilized by doctors and ER personnel, and then a call is made to New Hope. And New Hope goes to the emergency room with a van, ready, willing, able to take that person from the ER and bring them here so they can begin their long-term treatment and be here while they're stabilized and they find the appropriate program that has a bed open. That was the issue that concerned us always, was how do we close that gap? How do we stop people from signing themselves out of hospitals, walking out of ER doors, and then going right back to their dealers? Wouldn't it make sense for us if we could strike while the iron was hot? Get that person into treatment right away, because we know the literature tells us that the earlier treatment starts, the greater likelihood of success. So by formalizing that relationship, and it wasn't an easy task, and I have to commend everyone here for the incredible work that they put into it, getting New Hope into ERs, making sure that we're not violating people's HIPAA rights and privacy laws, and then making sure that they're able to get them here, offering a family support, getting social workers involved. This is the first of its kind MOU between a center like New Hope and our ERs, and it will save lives. I'm confident of that.
How does it not violate HIPAA, though, if you're making a phone call without, I mean, you have to ask the patient's permission to make the phone call first, otherwise doesn't it automatically violate HIPAA?
Yeah, we do ask for permission. And again, this only works if people want the treatment. We can't force people into treatment. So again, people have to be willing to do it and open to the idea and ready for treatment. And, you know, with my conversations with people who are recovering and their families and EMTs, this is the time to talk to them. This is the time to get them stabilized and show them that, you know, they've reached the ultimate low and now it's time to start building back their lives.
How concerned are you about New Hope becoming overburdened from this? And what are you concerned about in terms of other centers? Are there any others that could step up to the plate?
Well, sure, there are lots of others that can step up to the plate, and we're hoping that this will offer a template and others will follow suit, and we can have more centers like this where people can transition into long-term treatment. Am I concerned that they're overburdened? I'm hoping that they'll become overburdened because people need help, and we need to get them into facilities like this while they await long-term treatment, and we'll do everything we can to assist them and to encourage others to do the same kind of thing.
Now, if this is the only stabilization center of its kind, what if, for example, this is overburdened? Because there aren't really other options, as I understand. Is that correct?
Yeah, in Nassau County, this is the first of its kind. I'm not sure about Suffolk County as well. I think, Maureen, do you have any information about that?
Suffolk County has Talbot House, but this is the only residential facility where someone can physically go and receive treatment. There are lots of outpatient treatment facilities. Northwell has a number of them, and NUMC, the county, the opioid treatment program, has facilities. I imagine that the wonderful staff here at New Hope would work with the other treatment providers to expedite the length of stay in order to accommodate more people as they come through. The average length of stay is between 7 and 10 days, if need be. I'm sure they could work with their outpatient treatment providers to get that down to 3 days, if needed.
What has been the cause of the gap in the meantime? Has it been insurers require certification, or there was a lack of
centers like this? What has caused this delay?
Well, again, I mean, because people cannot be admitted into hospitals after a heroin overdose. So that's been part of the problem. And you can't force people into treatment or to be admitted. So once they're stabilized, medical protocol is that they're released. They're stabilized and they're sent out, given information about long-term treatment. But what we found is that when people left ERs, they were heading usually right back to their dealers to sort of ease the symptoms of withdrawal. So we recognized that as a gap, and that's when we enlisted the help of New Hope, so that we can close that gap. And again, it's a rotating, so it doesn't sound like it's a lot of beds, but it's a rotating basis. So the beds are full, but people leave as other people come. And again, we're hoping that we can expand this program.
Madeline, can you talk about how, where we'd be without the asset forfeiture?
Well, look, I mean, we couldn't start it initially without the commitment and without the asset forfeiture funds that we provided. That was, again, that's a lot of resources, $585,000 to New Hope, so that we could create a place 24/7 for people, but I had just spoken to too many parents and too many people who were in trouble, who needed help, and recognized this as an issue. Where do we go after we leave the ER? Because sometimes it takes us weeks before we can get into a treatment facility. So we provided the funds, we provided that seed money, and it's working. That's 2,000 people that have gotten treated since then, and I'm convinced that we've made an impact in those lives.
And the irony how the ones that are starting the problem, the dealers, are actually funding the recovery aspect of the equation.
Yeah, seizing that money from criminal defendants, usually drug dealers, and putting it right back into treatment, I thought was completely appropriate.
Is there still money from the seized money that's being funneled to Maryhaven?
Is it what? I'm sorry?
Is that still occurring? Is there still money from seized?
Well, now the forfeiture laws have changed recently under this criminal justice reform package, so we're going to see what it is that we can continue funding or not. But again, we're hoping that altogether, these are a lot of very brilliant people behind me, that we're going to be able to figure out a way to continue funding and making sure people get the help that they need.
Thank you, everybody.
Thank you.